Can you believe that it's 2025 and Black people are still facing racism in the healthcare system? Hi there, my name is Janita Maaya. Welcome to my YouTube channel. If you haven't subscribed, please take this time out to do so. Please do subscribe for more videos like this and other videos to follow. Let's jump in. Now, recently, a Black woman went to the hospital for her regular checkup, and on getting there, they had her, do some tests. And when doing those tests, you have to give some samples to the lab so that the medical people can figure out what's wrong with you. Now, on giving her test, there are those little things that they give you. I think like tubes, just like this little pen here. So they give you a tube, maybe to maybe put it can be a swab for the women. I don't know what men are putting in the tubes, but for women it can be a swab, and then the urine samples are a bit different. So that's different from what she had. Now, that particular tube that she had, they usually write your name on there, and then I think they put some other details to figure out what they're testing for or what tests you've paid for, so they can get that done and there are no mix-ups with other people, because God forbid you hand in your test and then they mix it up with some other person, right? Now, on the tube, in Uganda, on the tube they write with a pen. Yes, the hospitals I've been to, some hospitals will type it out, the system will automatically do a printout, and then they'll stick that to the tube. But in Uganda, they write a pen. But in this instance, it was printed out, and on printing it out, they wrote the word or the name King Kong. Now, if you're a Black person out there, you do know that sometimes when some person of a different race would want to make fun of you or degrade you or dehumanize you, they would relate you to a what? To a gorilla, for lack of a better word, gorillas, any animal in that bracket, because guess what? They are Black, some of them. Well, most of them are Black, and they tend to mimic human features. So there are times when people can say, oh my God, you look like a gorilla. Oh my God, da da da. But in this instance, they named her King Kong. Now, thankfully, she called them out and said, how was this mistake made? Obviously, they tried to apologize, but I don't think this is just some small mistake that they didn't see, or a small mistake that they didn't care for, because her last name is King. Now, where would King Kong come in? Which woman out there is called King Kong? Which human being out there is called King Kong? After that movie where the gorilla or the animal fell in love with a white woman. But I want you guys to watch it.
Can you tell me what's wrong with this sample?
Oh my God, I'm sorry.
Can you understand as a Black woman why I would have a problem with that?
Yeah, I can double check who.
How could that be a mistake? Because this King, that's my last name, right? Comma would be my first name, correct?
Yeah.
How do you misspell Kiera as Kong? That's insane.
Yeah, I can double check who did that. I'm honestly not sure who printed that.
Go ahead.
Yeah, sorry. Previously, we've never had any sort of issue like that. I understand where you're coming from.
I'm on fire. I'm on fire right now. That's unacceptable. And even if it is a typo, which if they want to pull that and say that that's what it was, how? Seriously?
Yeah, honestly, I'm not sure how that happened.
You know what I'm saying?
Mm-hmm.
So are you able to go in and see who did it, what? Because was that in my chart? How does that happen?
Let me double check. No, that's not anywhere in the chart. I do see your name is listed here as King, which, let me see.
Right. That's reportable. You know what I'm saying?
Mm-hmm.
That's
Yeah, I'm so sorry about that. Let me just try to get more information, okay? I do apologize. Again, it wasn't me who printed that label.
I understand.
I'm not sure how it happened.
I understand.
Now, I had to pause that video before we get to the end of it to just kind of chime in. And do you hear the lady in the background who's apologizing? And we all know what race that is, obviously. She's apologizing in the background. I'm sure it's not me who did this. Let me find out who did that. And this can't be me. There's no accountability. She could have said, if she was quick on her face, she could have said, you know what, this was a typo. Because sometimes, when you have, I'll say for the iPhones, and you try to text something, it will want to autocorrect you. Mind you, her name is Kiara, so she could have started with a K-E. So Is the keyboard racist too, or is she like, did she just decide to put that there? Was it like a cute little inside joke, or was it something that she wanted to delete afterwards and then do away with it? And in all honesty, I feel like it does reflect on the facility that she's in, because if they're able to misspell a name, what else are they not doing right? You know, are they misdiagnosing people? Are they treating people the right way? Are they treating people differently? Are they sending out patients who could be on that, you know, on that deathbed? Like, what is it that they're doing to other Black people? Because something as simple as a name, you know, a name slur, like something as simple as King Kong, can show like a bigger, deeper situation at hand. You know, sometimes you can see the tip of the iceberg, but like when you go deeper, it's like it's bigger. You know, maybe these are the same people who go into the break room and they want to laugh about, oh, this client came in and she looked like a King Kong. I just had to put her name down as King Kong so that I could remember her. Or this client came in and they had ABCD, and it's just in poor test. Honestly, it's just in poor test, and it's like a microaggression, or like some sort, like a tiny bit of racism, but it is racism in the end. Let's continue with the clip.
I cannot walk out of this office without raising that. Mm-hmm. You know what I'm saying?
Yeah.
Up as a concern, because what do you mean? That's a Black woman comes into, right, mm-hmm. doctor's office seeking care to be taken care of, and they receive.
Yeah. Okay, let me just try to get a little bit more info, okay?
Thank you.
I'll be right back. Medical assistant helping you today?
Uh-huh.
So she's just...
It was, I see that I put the name incorrect on there. It wasn't really my intentions to do that. Your name on there is not what it seems on there. Like I did mention to her, and she did mention to me that you want this all reported. That is totally fine. It wasn't really my intention to put your name like that. I did give it to you, and we were double checking it to see if it was incorrect or correct. We didn't mention anything.
We didn't double check anything. You said.
Now, it's the audacity of a lady coming in and making it seem like, oh, but you know, I made the mistake. I gave you the name. I gave you the tube and with the wrong name, and we double checked, and you didn't tell me if it was wrong. Now, excuse me, please. Excuse me, please. Who in this world is called King Kong? Matter of fact, let's Google it, because I might be here saying who in this world is called King Kong, and there's a whole King Kong out there, but no one names that child King Kong. It's racially motivated. This is a movie from 2025, okay? No one is called King Kong. It's just a movie, you know? No one is called King Kong. That's an ape. It's from the family of apes or something. Gorillas, all of them under it, you know? Because those apes sort of mimic human beings. So you calling a Black person an ape is showing that you know what, there's some sort of racism that you have in your blood. And I don't like how she just comes on and tries to be dismissive or gaslight her into thinking she's the one who made the mistake. Whole time it's her. She could have simply taken accountability and say, hey, I made the mistake. I was going to change that had you told me. She said, no, I gave it to you to double check, and you didn't double check, so it's all your fault. It's not my fault for being racist. No, it's not. That's what she's thinking.
Have you done a sample like this before?
I've done a sample, and then I gave it to you, and you went to the restroom.
Correct. So why are you saying that we were checking the name?
We were checking the name, because I asked if it was incorrect or...
No, you didn't.
Okay, but...
No, you did not.
Okay.
You said, we walked to the door. Correct me if I'm wrong, please. Correct me if I'm wrong. We walked to the door. You said, have you done a sample like this before? I said, no. And then, or I said yes, and then you said okay, and then you opened the door, right?
You opened the door and I gave it to you.
Correct.
Yeah,
so when did we check the name?
And I gave it to you, and then like I said, it wasn't my intention. I literally just checked my computer just now to see the name, and I was like, I know why she's upset because I put the name on there incorrect. But like I mentioned to her, and I'm gonna mention to you, if you feel some type of way of how I wrote it, and you want to report me, that is totally fine. But like I'm saying,
sorry, let me chime in just a little bit. It's how she's saying, oh, it wasn't my intention to do this. I didn't mean to do it. No, but I understand if you want to go and report. Now, who wants to just be reported for something like that? In my mind, I'll think, you know what? She's asking for forgiveness. Like, hey, forgive me. I didn't mean to do what I did. It was a mistake. She's like, yes, it's a mistake. I did that. But yeah, I understand if you want to go and report. It's being very dismissive. It's not even giving that she's understanding where this person is coming from. Or she just said, I see why you're upset because I saw the name. And just like, excuse me, what?
To both of you, it was really not my intention to put that on there.
So here's my thing. One, I don't understand how you could mistype something like that. I don't understand how you can write Kong instead of Kiera. How did you mistype that?
I was typing. To be honest, I type really fast. I don't double check when I'm typing really fast. I did put your name on there, but for some reason it went to an error. But like I mentioned to you, it was in.
So it auto-corrected from Kiera to Kong. That's crazy.
But
and then additionally, what I have a problem with now is that you're straight up fabricating that we checked the name on the bottle when we did not. Okay. Did we check the name on the bottle?
Like I said, for me, I did check it and I checked it with you, but you...
So you checked it. So you made a typo. You were typing really fast and then you checked it and then...
No, I didn't check it. I just put
So
it
now
on
you didn't check it.
I didn't check it. I just...
This is ridiculous. I'm done with this conversation. Okay, please give me her name and I will report it. Thank you.
I'll give you my name right now, okay?
I like how the black lady decided to take charge and say, you know what, I'm not going back and forth with you because now you're lying on my name. 2, you are just doing the most with it. So now guess who's going to be written up? It's you for being racist in your job. Racist in that. Guys, when people go to hospitals, they want to feel safe. I don't know who has been sick. I've been sick. Okay? When I go to a hospital, I've come for help. Okay? I can't figure out what's wrong with my body. What is my body reacting to? Like, patients are very vulnerable when they go to hospitals. You want to feel like the doctor cares about you as a patient. You want to feel like the doctor sees you. You know, the doctor is able to understand you. They're able to listen. They're able to listen to your pains. They're able to maybe figure out what's wrong. That is what you're hoping for. Now, imagine going to a hospital and the reverse. What's happening is the reverse, you know? They give you a tube, like, oh, do you know how to use it? Next thing you know, they're being racist by calling you an ape, which is it's broad daylight racism. I don't know what else you can call it. It's broad daylight racism. And when I was doing research, actually, medical racism is a documented problem. So black patients are not often believed when they report certain cases, when they're in pain, you know, and they also receive different treatment or something like that. I also know of there's so many black women who lose their children when they're giving birth because the doctors are not listening to them, or they could really care less because she's a black woman. Who cares to make sure she delivers the right way? Who cares? Like, there's a lot of medical negligence. Oh, Jesus. There's a lot of medical negligence when it comes to black people in these facilities. And mind you, at the end of the day, it's just like race shouldn't be mattering in certain places. Hospitals is where race shouldn't matter at all. Because you think, guys, life is precious. God created everyone uniquely and God gave importance to each person. Life is precious and it should be treated as such. Now, it's very disheartening to know that there are black people out there who go to hospitals and they're treated differently just based on their race, you know. They're given a different diagnosis, or all sorts of bad things happen to them based off that. I came across this video about a gentleman who talks about how about medical racism. I want you to watch it.
I was tagged a lot in this video created by Dr. BCW. In it, she talks about how the first-line treatment for all black patients that have hypertension or high blood pressure is a different medication than all other races. My name's Joel, the Medical Mythbuster, and let's talk about high blood pressure and race-based prescribing. For generations, doctors have been taught that black patients with high blood pressure should be treated with a smaller range of medications than other racial groups. Specifically, the first-line treatment for black people with no comorbidities and high blood pressure is a calcium channel blocker or a thiazide instead of an ACE inhibitor or an ARB. While it is possible that taking a thiazide or a calcium channel blocker as a first-line treatment for high blood pressure could be managing someone's high blood pressure well, it's also possible that this race-based guideline could be limiting options for black patients. In fact, this study from UCSF analyzed the health records of 10,000 patients. It found that despite primary care doctors following race-based prescription guidelines, black patients patients were more likely to have poorly controlled high blood pressure when compared to non-Black patients. That suggested that race-based guidelines weren't more effective. And they found that other considerations were much better than race, like adding a second or third drug, making sure that patients were actually adhering to medication, and making sure that there's lifestyle and dietary changes. And studies have shown that high blood pressure varies amongst Black Americans versus Africans versus Black people from different countries, yet we still use the same first-line treatment to manage all Black patients. We have to be cautious of assigning too much weight to race as a proxy for pharmacological therapy. When we don't critically engage with the whys of a disease process, we miss out on better ways to treat our...
Now, I'm by no means a medical student. He did drop some names in there, you know, but I got his point. Like sometimes, like Black people, he has mentioned something about Black people suffering from diabetics the most if you compare them against Africans or other Black people in other countries and whatnot. So that is a big problem. I think I've also seen it somewhere else where it says like diabetes and high blood pressure like such a big deal in the Black community. And let's be real, I don't want to come here and someone gets offended by what I'm saying. If I'm wrong, let me know, but I'm pretty sure that I've seen it somewhere and it is there. But I hope that you see how a whole doctor in his profession is able to see that Black people are not treated the right way, right? Like Black people are not given the right medication, or there's no deep diagnosis of what's happening. There's no deep dive into what's happening with them medically. You know, it's just like, oh, you have high blood pressure. Okay, here's some meds, you know? So that's the thing that he's talking about. And that's the thing that we need to sort of work on as a community and work on as hospitals, because you need to do better. Now, I also do understand, or I do believe that so many times when a Black person talks about their experience in the medical field, they are not taken as serious. So many Black women are coming online, they're saying, hey, we are mothers to be, we feel like we're not heard by these doctors, you know. There's a whole tweet or thread where a lady was talking about how she was suffering from infections and the doctors were not listening to her, or they were not prescribing something that was helping her out. Time and time again, Black people are coming up and saying, hey, we don't feel heard in this field. And people are being dismissive, like, oh my God, not everything is about rest. I saw one of the comments, by the way, in the other video. Oh, not everything is about rest. Some things are just common mistakes. I beg your pardon. If it's your life on the line and they're just playing, what is it called, Russian roulette with your life, would you be okay with just saying, oh no, everything is about rest? No, you fight for yourself and you fight for your life. I believe that's what should happen. I want you to watch this clip of a lady who was trying to let other people who hear the rest know what was happening with her medically. They were laughing at her, they were being dismissive, and that is what is happening to Black people all around the world. They're being dismissed and being laughed at.
This is what happens when a Black woman tries to share a personal medical experience.
We're going to go with the Black people.
Segregated now?
Yeah, white because
we've been segregated.
Oh my God. Well, I'm both. I'm white. I'm white and black. Ramon is pulling I go both ways.
We're gonna hear from the culture.
We're going to hear
And we're gonna go to Lenora.
What question would you like to answer?
Yeah, Lenora.
When did I feel that my life was most meaningful? Last year at this time, I gave birth to a 29-weeker, and I was in the NICU for 50.
Wait, excuse me, time out. You gave birth early? Because normal is what, 40 weeks?
It's 40 weeks. And so me and my son almost died.
Oh my God, are you serious?
I had some poor medical service, as most Black women experience.
Do you think that the treatment that you got was because you were Black?
I know the treatment that I got was because I was Black.
Why?
I have fibroids, and I had a fibroid that was degenerating. They just didn't believe that I was actually in as much pain as I was communicating. And so instead, they thought that I was addicted to drugs.
What?
And then treated me as I was asking for pain medicine for 5 days, that I was trying to hurt myself and my baby. And so because I was in pain for so long, it induced my labor.
So how would a white woman be treated differently than you?
It's a good question.
No, that's a good question. Medically, how would they have been treated? May I ask?
Should that have been you? And there is a study that just came out last week that a white woman, you would have gotten the pain medicine during the time frame in which you needed to in order to manage it and get ahead of it, so that that would have never happened.
Well, let me tell you something. I gave birth to my daughter, and I was major pain, and I had a nurse, and she was black. And I said, I am having so much pain, and she wouldn't believe me. She goes, you're not having pain. And I was screaming. I'm like, you, I need painkillers. I mean, I didn't have a second baby because of the pain I had from my birth. And I was a white woman. My doctor didn't take care of my pain. My nurse didn't take care of my pain. That's not how it usually goes, is what she's saying. I'm just saying, I have pain and no one pays attention to my pain.
Right. So
She's saying that's not how it goes. I'm just saying.
So I hear you.
I mean, it happens.
So you can see how the white lady decided to insert herself into the situation and made it all about her. When this lady was talking about statistics of what's happening in her community, what's happening with her race, and this is the deal every time. Like, black people are saying something and then they're being dismissed and being, oh my god, no, but it also happened to me. I just had a black nurse and she didn't listen to me. Like, the lady is clearly, this is not a one-time story. The lady has clearly said that sometimes as black women, when they're going through pain, they're asking for medication, the doctors think they're drug users, instead of thinking like, hey, this is someone who is in pain and they actually need medication, so how about I give them the medication? It's really unfortunate, but things like that do happen, and they occur in communities like this. But what's the solution? I hope the solution is that you are studying to be a doctor. I hope that you become a whole doctor, okay? And I like the fact that the lady decided to report her so that she can be dealt with by the hospital. And black people need to stop letting certain things slide. Like, if you see something that has been done to you that's wrong and you're well within your right to complain and to go against it, then by all means you should. The other thing would be like hospitals making sure they're very careful, in how they treat patients, which is something that they teach in medical school, I hope. I mean, everyone needs to be held accountable. The lab attendant should be held accountable. The lab should be held accountable. The hospital should be held accountable. They should apologize and put certain rules in place so that people can know that they can feel safe when they go to these hospitals. Also, like I said at first, I'm hoping that we have more black doctors, we have more black nurses. Like, it would be great to see my people in places like that feel safe. Well, I mean Uganda, most of my doctors are my fellow Ugandans. I believe that the medical school here is actually really great. It does produce really nice doctors, so we're so grateful for that. We've had amazing doctors here. The only time I've had like a different doctor treat me has been an Indian. She did treat me for something, but yeah, it does happen. But she was lovely, can't complain. She listened to me, she listened to my suggestions, because I told her, oh no, I react to this, I don't like this, my body tends to go well with this. So I like that she did that. But anyway, that's not why we're here. We're here to say that medical racism needs to stop. And mind you, there's even racism against other black doctors in the medical field. Sorry for another day. But yeah, guys, with that, I will say bye and farewell. I hope to see you on the next one. If you like this video and any other videos like this, please make sure you give me a subscribe, give me a follow, give me a like, give me anything to show that you like the content that I'm putting out. Also, please like this video, because it does YouTube does pick it up and then show it to other people. So yeah, let me know what you think about this one. I will see you next time. If you want to reach out to me for consultation, reach out to me at joannamaaya@gmail.com. There's also my new website at joannamaaya.com. Yeah, that's a new website. It has all my info there. You can find it there. Also, you can follow us on all our social media pages at Janita Maaya. And I hope to see you guys next time. With that, I say bye. See you.